Welcome, my dear friends. Once again, Dr. Anuradha Dhawan here. I welcome you to this video in which we'll be discussing important fundus images for your FMGE exam. So this is in a continuation of with my last video in which we mainly discussed the interior segment images. So here we are going to have a high yield review of all the important fundus images which will be helpful for your upcoming FMGE exam. So once again, Dr. Anuradha Dhawan, your ophthalmology faculty. Dear friends, you can contact me on my email, my Telegram, or join me on Instagram for further updates in ophthalmology. So let's begin with our session here in which we are going to discuss must-do fundus images for FMGE exam. So let's come to the first image here. So as I told you last time also, whenever there is an image-based question, sometimes it can be a spot diagnosis or sometimes it can be along with some case history or clue in the case statement, which can tell you something about the image. Okay. So in this image, as you notice, there is a history. There is a clue that the patient had a history of floaters, flashes, that is photopsia, and then a curtain-like shadow falling in front of the field of vision. And if you see the image carefully, you can see this is the retina. You notice this is the retina, but you can notice this retina is not attached. It is detached. How I make out that it is detached? Because this retina is appearing ballooned up because of the fluid behind the retina. So how will I be identifying a retinal detachment? If the retina is ballooned up or pulled up, and you kind of have a feeling that there is a fluid under the retina. So that means the retina is detached. So you can see this retina is corrugated. It is ballooned up. It is not looking reddish because it is detached. Okay? And you can very well notice a large tear, a large tearing of the retina. And by the shape of the tear, you can identify it's like a horseshoe. Okay? So this is how you will identify a fundus image of retinal detachment along with a horseshoe retinal tear. And we know that when the retinal detachment is due to a tear, then it is known as rheumatogenous retinal detachment. So dear friends, this is the image of a rheumatogenous retinal detachment showing a horseshoe tear in the retina. Okay. Moving on to the second fundus image here, which is very commonly asked. They will be giving you, of course, a clue that this patient is a diabetic patient. Okay. So if they show you the fundus of a diabetic patient, and here you can see in the fundus, you are seeing multiple retinal hemorrhages here, but more remarkably, see this green arrow? This green arrow is pointing towards a bunch of the new vessels. And you can see an optic disc underneath. So there is an optic disc underneath, but there is a growth of a bunch of the new vessels on this optic disc. So friends, once there is a new vascularization on the retina, on the optic disc, that is called as NVD or neovascularization of the disc. So this green arrow is representing neovascularization of the disc. And what's here marked by the black arrow here? Again, if you notice carefully, there is a new vessel growth on the surface of the retina, but which is not on the optic disc. So it is called new vessel elsewhere, neovascularization elsewhere. So in a diabetic patient, when on the fundus images, we are noticing new vessels on the optic disc, we are noticing new vessels on the retina elsewhere, that stage of diabetic retinopathy becomes proliferative diabetic retinopathy. Okay, so if there is a fundus image like this in a diabetic patient in which you see bunch of the new vessels coming up, front of the new vessels coming up, you can clearly mark that this is a case of proliferative diabetic retinopathy. Okay, no doubt. Moving on to another case scenario, another fundus image in a diabetic patient. Now, how it is different from the previous one? So number one, you can notice very carefully here that there are no new vessels. You do not see any new vessels on the surface of the retina anywhere, not on the optic disc, not anywhere. So it is not a proliferative stage. What we are seeing here, most of the changes, they are in this central part of the retina. And what we call central part of the retina? Macula. So we are noticing small red dots, which are the microaneurysms, the bigger red dots, which are the retinal hemorrhages in the macular area. At the same time, we are able to see these yellowish deposits, friends. So marked with the black arrow here, even here, even here. So these yellowish deposits are the lipid deposits, also called as hard exudates. So when we see these lipid deposits in the central retina, that is your macular area, along with the microaneurysms, retinal hemorrhages in a diabetic patient, so that is a case of diabetic macular edema. And we know if there is a diabetic macular edema, a diabetic patient is likely to have vision loss. So this is how we will identify diabetic macular edema. Okay. Moving on to another fundus image here. Here they are asking you, they have marked a lesion with an arrow and they are asking you how to identify this marked lesion. So here, if you notice again, now do not get confused with the previous images, because most of the retinal vascular diseases, they will have retinal hemorrhages, they will have superficial as well as deep retinal hemorrhages. But you have to see that whether it is a diabetic patient or it is not mentioned or what else is there. So here, besides the retinal hemorrhages, what they want you to know is what is this lesion which is marked by the black arrow. So if you notice this lesion, this is like a fluffy superficial spot. It is like a fluffy, like a cotton wool, fluffy like a cotton wool, a superficial spot. And if you see clearly, it is very different from these hard exudates, which I made you see in the previous image. These are more discrete, more deposited within the retina, whereas this one is as if it is superficially placed on the retina, more fluffy, like a cotton wool. So that is why it is called cotton wool spot. It is also known as soft exudate. This actually is not any deposit. This is a ischemic area of the retina. The cotton wool spot actually presents an ischemic area of the retina, which can be seen in multiple conditions. It can be present in a diabetic fundus also. It can be present in the hypertensive patient also. It can be present even in HIV retinopathy. Okay, so here, if you have to identify that what lesion it is, cotton wool spot will be appearing like a cotton wool, like, fluffy on the superficial layers of the retina. Okay, so this is how will you identify this, my dear friends. Moving on to another image. So can you please identify this image? This is a fundus image and you have to identify what is there. So what are we noticing here, friends? So very, very clearly, you are noticing multiple round spots all over the retina except for the central area. So multiple yellowish white spots, very uniformly placed all over the retina except the central area. So these are your laser marks on the retina. Which kind of laser marks? Pan-retinal photocoagulation marks. Pan-retinal, that is all over the retina except for the central area. And I'm sure all of you know that pan-retinal photocoagulation is done whenever there is neovascularization on retina, for example, in proliferative diabetic retinopathy. So if you see this kind of picture, please remember it is pan-retinal photocoagulation marks. Moving on to another picture with a case scenario. Now, this is again a very, very classical fundus picture often asked in the exam. There can be an associated history that a 60-year-old hypertensive patient presenting with sudden painless loss of vision. Sudden painless loss of vision. So what do you notice in the retina over here? So you are noticing that whole surface of the retina, all over the retina, you are seeing multiple retinal hemorrhages, superficial as well as deep. Whole of the retina is splattered with the retinal hemorrhages, as if you splash a tomato on a surface, the whole of the retina is giving tomato splash appearance. This appearance is also called as blood and thunder appearance. So when we see whole of the retinal surface covered with multiple retinal hemorrhages, and if you notice carefully, even the disc is swollen because the margins of the optic nerve are not clear. So even the disc is swollen. The central area is also swollen. Okay? So this is a case of central retinal vein occlusion, dear friends. So please keep this picture in your mind. It is very commonly asked picture. Central retinal vein occlusion. Now, if the similar scenario is there, but retinal hemorrhages are present only in one part of the retina. So you notice here, so in this fundus image, you can clearly notice that this much part of the retina is having retinal hemorrhages, but this area, this area, this area is normal. So multiple retinal hemorrhages in one quadrant of the retina. It means, again, it is a vein occlusion, but a branch retinal vein occlusion. Patient will have similar history, sudden painless loss of vision, but the diagnosis becomes branch retinal vein occlusion because only one part of the retina is involved. Okay? Now, moving on to, from the vein occlusions, moving on to another case scenario in which again the history can be similar. 60-year-old hypertensive patient with sudden painless loss of vision, but fundus picture is absolutely different. Okay? So in this fundus image, what are we noticing? What is striking us the most? Okay? So if you see this fundus image, the most striking feature is whole of the retina is again appearing whitish. It is appearing pale. Okay? No hemorrhages on the surface of retina. The whole of the retina is appearing pale, but the central area is appearing reddish, like a cherry. The central area is appearing reddish like a cherry. The rest of the retina is appearing pale because of the ischemia. When there will be ischemia, when there is no blood flow to a part. So when there is central retinal artery occlusion, the retina will become ischemic. It will become pale whitish. And the central area will appear cherry red or bright red in the center in contrast to the rest of the pale retina. So here our diagnosis is central retinal artery occlusion. So very, very contrasting picture. I show you once more. Vein occlusion, whole of the retina is splattered with the retinal hemorrhages. Central retinal artery occlusion, whole of the retina is ischemic. It is pale. Okay? So then I will mark my diagnosis as central retinal artery occlusion. Okay, so from the vascular lesions, let's move on to a different kind of the fundus image. It can be given a history along with most likely. Supposedly, there is a 65-year-old patient who is presenting with metamorphopsia. Metamorphopsia means distorted vision, that when you're reading or when you're seeing an object, the image becomes distorted. So that is called as metamorphopsia. So this is a very classical hint for if there is any disease of macula. So when there is disease of macula, the patient will have distorted vision. Now, what are we noticing in this fundus image, beta? So we are noticing the disc is normal, the vessels are normal, okay? But again, these yellowish spots in the central retina, yellowish spots in the central retina or in the macular area. Now, how do I differentiate it from the other yellow spot which I showed you? Remember, what did I show you? The hard exudates or the lipid deposits. Now, it can be a bit difficult, but the clue and the hint is these yellow spots are called as drusens. These are the drusens. They are feature of dry age-related macular degeneration. Now, how will I differentiate this from hard exudates? Hard exudates are usually seen in vascular retinal diseases. Okay, hard exudates are the lipid deposits which occur due to the leakage from the vessels. So they will be seen in retinal vascular diseases. So there will be some retinal hemorrhages or microaneurysms whenever those lipid exudates will be there. Whereas this disease, age-related dry macular degeneration, is not having any vascular problem. Here, these deposits are actually debris. They are lipofuscin deposits. So if you notice carefully, there are no retinal hemorrhages, no microaneurysms, so only yellowish deposits. If only yellowish deposits are there, which are actually deeper than the lipid exudate, but it's fine. So simple way to differentiate drusen's from hard exudates is drusen's will not have any retinal hemorrhages or any microaneurysms in the fundus picture. And of course, there will be some case history. If there is metamorphopsia in an old patient, no history of diabetes, so you identify this as drusen's in dry age-related macular degeneration. So I hope we have differentiated the hard exudates and the drusen's there. Now, another clinical picture, another typical case scenario, another very, very classical picture of the fundus. 20-year-old male complaining of night blindness. So night blindness in an adult male. And with this typical picture, so you can see very unique features here, beta. So if you look at the optic disc, you are seeing it is appearing pale. It is not pinkish in color. It is yellowish pale. If you notice the retinal vessels, they have become very, very thin, like a thread. They are called attenuated arterioles. And classically, you can notice these black clumps, these pigment clumps. So these blackish pigment clumps, which are called bony spicule clumps. So these three triad, the pale optic disc, attenuated arterioles, bony spicule, black pigment in the mid-peripheral retina. This is classical of retinitis pigmentosa. So this fundus picture, I don't think there is any problem if we remember these features in identifying this retinitis pigmentosa. Okay, right? Now, moving on to another favorite with the examiner. In the retina, they can show you the fundus image or a related question. So I'm sharing this with you. A child with leukocoria. Okay, so you notice leukocoria means the white reflex from the pupil and a mass in the retina. Now, child with leukocoria and a mass in the retina. Now, if this mass is specifically cauliflower-like mass or mass associated with calcification, then high chances that this is a case of retinoblastoma. This is a case of retinoblastoma. A child presenting with leukocoria, friends, a cauliflower-like mass with calcification in retina, please mark it as retinoblastoma. And one related point about retinoblastoma, because histopathology, again, a favorite question with examiner, if they show you this slide, so you can notice these tumor cells arranged in a floret-like manner, in a rosette-like manner, and this typically appearance is known as flexner wintersteiner rosette. On histopathology, they are specific of retinoblastoma. So they show you a history, they show you a picture of leukocoria or a cauliflower-like mass. If you get flexner wintersteiner rosette, the diagnosis is retinoblastoma. Right, so moving on to the last fundus image, which is important for your exam. So here, they can give you a history that a patient is having, like, being treated with some medication. A patient of rheumatoid arthritis on some long-term medication, okay? Or they can let you know directly if the patient is on chloroquine, okay? So what can be seen in the fundus? Okay, they can show you the fundus image. So what do you notice here in the fundus? You see these right in the center, these marking, the central area is dark, then there is a lighter area, central area is dark, then there is a lighter area, then another darker area, like the concentric rings of the bullseye, the light, the dark, the light, the dark. So that is why this appearance of the fundus or macula is called as bullseye maculopathy. Okay, so if right in the macula you see bull's-like eye-like appearance, bull's-eye-like appearance of the macula, that is bullseye maculopathy, which one of the common reason is chloroquine toxicity. Patient of rheumatoid arthritis can often be on the long-term chloroquine or hydroxychloroquine, and you can get this kind of picture. So this is, again, an important fundus image for the exam to be remembered. Okay? So these were the important fundus images. Often the question, one or two questions they have been asked from these fundus images. So I hope this video would have given you a high-yield quick revision for your upcoming exam. So once again, friends, do contact me on email, follow Telegram and Instagram for high-yield points in ophthalmology. Thank you very much and keep learning, keep smiling, take care of yourself. All the very best, my friends.